Hi everyone, this is Dr. Lin. Today we are going to talk about skin and food allergy. I have a lot of patients that comes into the office with multiple different allergies. Most of them are babies that has severe skin issue. As you see in the picture here, rashes on the skin. If the baby eats certain food, the lips swells up like a peanut allergy. Or little kids that comes in with severe rashes on the joints. For example, the elbows, the armpits, the skins of the neck, the ears, the knees. And they have severe itches at night, and the itches just unbearably the kids are invariably scratching their skin because the itches will not stop. And the itches cause them to scratch the skin until the blood comes out. It's very heartbreaking. And they have taken the kids to medical doctor, to pediatrician, to dermatologist, and all they do, the only thing they do for the kids is really just to give them cortisones, right? Cortisones to apply on the skin, or to have them do some blood tests to see what foods are causing the allergic reaction and tell them to avoid certain food. But most of the time, these testing and these applying on the cream will not work. And the doctor tells them there's really nothing they could do. The kids will eventually grow out of it. Eventually, when kids get to age 6 or 7, everything's going to stop. But is that true? Partially true. Partially true. Most kids, the allergy will continue to their teens, to their 10s, to age 10, age 13, and eventually when the immune system started catching up, then the allergy started going away. But if your kids, if your child, if your baby, it's 6-month-old, it's 1-year-old, do you think that they can last until all the way to 10, to 9, to 13, and you're going to suffer all these 10 years taking care of the baby every night getting up? Is that what you plan to do for your kids? The reason why we started this topic, I started this topic because I myself have experienced all these issues. My son, when he was at age 2, he started severe skin rashes, severe skin allergy. Just exactly what I described. He itches all night. The arm, the leg, and the ear, the knees. Everywhere he scratched, blood comes out. A lot of blood come out. And the ear, even the ear, because it itches so much, the ear starts to crack. It seems like the ear is going to fall off. And he cries every night, and I have to hug him. I used to have to carry him the entire night, basically, and stop holding him from scratching. And my wife and I were very tired because he couldn't sleep. And everywhere we go, if we go on a certain vacation, if we go on a certain weekends, out to a certain restaurant or certain hotels, he could not stop itching. It was continue on, and we had to avoid every food possible, and it's very tiring. And the kids wanted to eat food. He wanted to eat this, he wanted to eat that, and we couldn't give it to him. And he's feeling sad, he's feeling very depressed, and we're feeling depressed. And we're feeling awful because we could not give any food to him that he wanted to eat. Most of all is the tiring, is a stress and constant stress and constant tension that my wife and I is suffering with. And seeing our child suffering, that makes us even 10, 100 times more bad. Because we want to, you kind of feel like we want to take his place. We want to itch for him. Just please stop. That's the feeling that we have. Okay. So for the past years and years, I've been studying and learning and different technique and different ways out there to basically help with this condition. And I've finally found ways to do that. And that's the reason why we're here to talk about the different causes of this particular asthma or skin issue, the way we can test it, and the way we can help to release this particular issue once and for all. Okay? If you get treated, if you get helped on the allergy, usually by 2 to 3 months, or at least 4 or 5 months, everything clears up. And I have seen kids in our office clears up their allergy within a few months. And their life goes back normal. They can eat anything they want. They're happy. Their parents are happy. They sleep all night long. And I'm happy because I'm helping them getting better. Okay. So don't believe anything that the medical doctor says. The medical doctor say there's nothing they could do. Just wait. Don't wait. If doctor said it's all in your head, he's gonna live like this for the rest of his life, and just keep on applying the cortisone cream, eventually it's gonna go away. Don't listen to them. Find ways to help your kids. There are ways, there are methods to help with these eczema, with this skin issue and food allergy issue. There are ways. So I don't want you to give up hope. I don't want you to feel sad, because there are ways out there. Please have hope and continue reading, listening to me, and you'll see exactly what I mean. And the entire lecture, it's about 1 hour, 1.5 hours. So be patient. If you're going to be a patient of ours, if you're going to come to our office for consultation, please look over this particular DVD 2 times. Because what I'm going to say is going to be very informative. There's going to be a lot of information that you will not be able to catch only one watch. So watch it twice. If you watch it twice, you come in, we'll give you a free consultation. If you don't watch it twice, if you come in and we ask you a certain question and you don't know, we'll have to charge the consultation for $120. Okay, so please watch it. You get your free consultation with me. Okay, and we see various type of allergies, such as the peanut allergies, the allergy with the animals, with the dogs, the cat dander. We see allergy with the sun radiation allergy. We see allergy with pollens, flowers, weed, and all different kind of food allergies, such as beef, eggs allergies, milk allergies, cheese allergies, certain food allergies. And we also see asthma. That's also a certain allergy as well too. Okay. Now this particular allergy we call anaphylaxis. When the kids eat peanuts, the allergic reaction is so strong that it causes the lips to swell up. It causes skin rashes to come up right away. It causes the lung to constrict. They have difficulty breathing. If kids have this condition, they have to be sent to the hospital right away. They have to go to the emergency right away. Okay, and we have seen a lot of kids like that. There are kids actually dying from eating peanuts. That's how severe this kind of allergy is. And it's happening all over the place. It's happening everywhere. Not just your kids. It's everywhere. Okay, and there are ways to help with this. There are ways to totally eradicate this. Okay, so please go ahead and continue watching. And I'd like to say that in our clinic, we do not aim to cure allergy, because I cannot claim to cure allergies. But what I can say is we're helping to finding out the causes of the allergy. When we found out different causes, which I will discuss below, then the immune system is going to catch up. When the immune system catch up, it's going to basically fend off all the allergen coming from the food, coming from the air, coming from the environment. It's going to push it away, and your body is going to be protected. And when your immune system is catching up, it's going to kill all the bacteria, virus, and parasite, whatever it is affecting the allergic reaction, and the body gets better. Okay, so we as a doctor, we're helping the body to heal. Got it? We're helping the body to heal. And we are letting the body taking command. The body has the ability to heal. We had to believe that. You had to believe the body has the ability to heal. We have to just give it the right environment, the right food, the right diet. That is extremely, extremely important, and that should be the main goal of our treatment. So once the kids are healthy, once the immune system comes up, they can eat anything they want. They're going to sleep really well. The itch is going to be all gone. Okay? So we do not cure allergy. The body does it. We help the body takes away the allergy. Okay. There are a lot of different causes. A lot of different causes to allergy. And there are layers and layers and layers of causes that the allergy may do on the skin. All right? And usually these allergy are attacking 3 layers of the skin. They are the epidermis, dermis, and the subcutaneous layers. And it affects the entire layer of the body. Okay, the very first causes of the allergy, most kids when they come into the office, is inflammation. Inflammation and sugar. They comes in hand in hands. If you have inflammation, you have sugar. If you have a lot of sugar, you have inflammation. It goes hand in hand. Okay, and a lot of food causes inflammation. A lot of food increase sugar activity in our body, such as sugar, such as the food that causes inflammation, such as bread, pasta, noodles, cakes, candies. And also certain vegetables, we call it nightshade vegetable, such as potatoes, French fries, tomatoes, bell peppers. So if your kids have severe itches, severe inflammation of the skin, do not feed your kid this kind of diet. Do not. Avoid at all costs. At all costs. Anything sweet, including fruits, including pineapples, mangoes, apples, pears, because these fruits are just way too sweet. Okay, because the sweetness of the sugar increase inflammation. So do not feed your kids with these kind of stuff. Okay, a lot of kids when they go to school, they eat Kool-Aid, they drink Kool-Aid, they drink Coca-Cola, they eat cookie, they eat chips. Cafeteria food in school are just horrible. They feed pizza, hot dogs, sandwiches. It's starches. It's all sugar. So I would really advise you bring sack lunch for your kids. Cook your own food and have the kids bring it to school and have them eat at school. Okay. So having the right diet, like we mentioned, are extremely important. That should be the primary thing that you should do for your kids. Okay. So when you buy food, make sure you read all your labels. Let's go to this first. So let's say this is Dorito chips. Okay. When you buy any kind of food, look at the ingredients. Now, one really simple trick is if you look at an ingredient that has lots and lots of stuff, you know this food is bad. Why? Automatically, there are, if you look at the bottom, disodium isonate, disodium glutase, sodium caseinate, these are preservatives. Preservative is a toxicity that will affect the immune system and the skin. So if you see any of this, please do not buy it for your kids. Okay? Or yourself. Alright? And they have partially hydrogenated soybean and cottonseed oil. This is, we call it rotten oils. They just kind of put another name. It's basically a rotten oil. And they put it in here so they can cook the chips with. Okay, these are horrible. And not to mention artificial color, yellow 6, yellow 5, red 40. Colors, chemicals. Kids cannot handle it. The immune system is bad. Okay. Corn syrup, sugar, red bell pepper cause inflammation. All right. So you gotta make sure you know how to read. Okay. Anything that you don't understand, anything that's bad, do not buy these. Okay, so look every single ingredient. Okay, when you have a baby and the baby is 6 months to a year and you're breastfeeding, okay, it is up to the mother. Mother has to control the diet. Mother's health has to be at top notch. Mother have to make sure the body system is clean of sugar, clean of toxin, because everything that the mothers eat passed down to the baby. Okay, so if the baby has severe asthma, severe allergies, mother has to be treated as well as the baby. Both have to be treated. So the mother's milk will be clean. Feed it to the baby. Okay. And also when cooking, when you're cooking at home, some parents tell me, oh, you know, they don't go out to the restaurant, they cook at home, they're clean, they eat clean. But when I start asking them questions about what stuff they use to cook with, the condiments, okay, they use peppers, it's horrible because it causes inflammation. They use certain soy sauce that has a lot of preservative in it. They use the oyster sauce, which has a lot of MSG, which causes inflammation as well. Okay, it's just sauces that they use hot pepper sauce that came in a glass jar, which has been putting on a shelf for 2 years. Tons and tons of preservative in it. Do you expect your body to be healthy eating those kind of junk, those kind of poison, toxic stuff? Okay, so be careful of what you cook. All right, and going to restaurant, it's also very important. Nowadays, restaurants are all over the place, and people are lazy to cook. But if you're lazy, your baby or yourself will suffer. Your baby's skin will suffer. So you cannot go to a restaurant. I always recommend patients when you have this skin issue, do not go to particularly Chinese restaurant because they have MSG. Even if you tell them don't put MSG in it, they will continue to put MSG because everything is already pre-cooked, pre-made. Don't believe a word they're saying. Okay, so if you have to go to a restaurant, go to a steakhouse, go to a Sizzler, go to salad place, supplementation. Okay, where they have salad and more clean food, where the meat is cooked with high quality condiments. So choose your restaurant wisely. If you don't know where to eat, what to eat, you come to us. We'll give you ideas of what restaurant is good for you, what kind of food is good for you, what kind of condiment is good for you, how to cook, and all these issues. Come to us. We'll teach you how to do it. Okay. And snacks for the kids. That's a big issue because a lot of kids like to eat cookies and chips, and snack is you gotta stop the snack. Okay, maybe find something that he's not allergic with. Every kid's different, so be careful on the snack as well too. All right, packaged food and canned food and glass. Bottled food that's been on the shelf without refrigeration, that is something that you cannot take. You cannot feed that to your baby, to your child. Think of the food that you cook. If you cook the food tonight and you don't put it in the fridge for 3 or 4 days, what's going to happen? The mold, the fungus is going to grow, right? Bacteria is going to attack the food is going to smell foul. Think about the can, the glasses. They can stay on the shelf for 1 whole year without getting spoiled. Imagine how many preservative, how much chemical toxin is in that can, is in that bottle. Do you want to feed that to your kids? Okay, genetically modified food, that's a big, huge issue. Wheat, soy, fruits, apples, pears. If you go to the supermarket, about 50, maybe 70-80% of all the food are genetically modified, or they have pesticide, spray huge amount of pesticide in it, or spray different kind of chemical to preserve the food, to make the food look beautiful, to make sure the food doesn't go spoil, to make sure the vegetable doesn't grow anymore. Okay, so these are chemical foods and lots of chemical in the supermarket. Okay, if your kids have issue, really go to a very organic, go to your local farmers market, buy the organic food, or grow your own food if you want to. Okay, modified food, like we said, the wheat are modified. So that's the reason why I told you no bread, no pasta, no noodles. Okay, because all these are made out of wheat and they are genetically modified food. Genetically modified food decrease in immune system. Decrease immune systems. Do not feed them. Soy also. Okay. Now, if your baby is drinking the powder milk, there are very good quality powder milk out there. Go to the Amazon and search for it. Very good quality, that is organic milk powder. Make sure you give them those really good milk powder. Don't buy those milk outside the shelf. You know, if you go out to a certain market, Target or Kmart, you see those you know, generalized powder milk for the baby. Those are horrible. If you look at the ingredients, they are, most of them are chemically made material. Chemically made. Okay, that's a horrible milk powders. All right. And not to mention the eggs. If the baby, if the kids is 1-year-old, 2-year-old, 3-year-old, and you start feeding eggs, start feeding chickens, start feeding meat. Okay, the meat that you eat, it's all injected with hormones, or injected with tetracycline, which is the antibiotics. Okay, they're full of hormones and chemicals in these meat. Okay, kids with low immune system, kids with allergic reaction of the skin cannot eat this kind of food. Okay, you gotta go buy the real good quality chicken, beef, and eggs. Okay, buy the expensive one. Don't be afraid to spend money for your kids, because they're gonna grow up happy and healthy. And when kids are happy, you're happy. I know. Okay. There's so many different kinds of allergy, and I mentioned a few below: smoke allergy, pollen allergy, fragrance allergy, nuts allergy, soap allergy, detergent allergy, dust allergy, pets allergy, weather allergy, and sun allergy. All these allergy can be taken care of. They can be taken care of. Okay. All right, we just talked about chemicals and heavy metal toxicity. Okay, these are toxins that you don't want your kids to expose to. Okay, avoid them at all costs. Okay, autoimmune issue, when the kid's immune system is low, the allergy reaction comes up. Okay, so our main goal when you come here is that we are going to find out for you which immune system has issue. Okay, we're gonna do a series of blood tests. We're going to check what kind of immune system has issue. Is it a white blood cell? Is it a red blood cell? Is it eosinophil? Is it a T cell issue? Is it a natural killer cell issue? Is it an interleukin issue? Is it a cytokine issue? You may not understand what I'm talking about, but I will discuss them in a later slide about different tests to test for immune system. So our main goal is to increase the immune system of the kids, so the body will handle all those allergy reactions. Okay. Now this is huge. Bacteria, virus, mold, and parasite. This is a huge issue. The most common parasite that we see in kids under the skin is called, we call it scabs. S-C-A-B-I-E-S. Now these little bug parasites, they live under the skin. They're very, very active at night. Very active. During the day, they're dormant. So during the day, the kids doesn't itch as much, but especially when the nighttime comes, when it's hot and humid in the night, summer night, kids, they go crazy, they itch like crazy. And the parasite scab is a huge part that is responsible for the itchiness. Okay. Not to mention the funguses on the skin, not to mention the bacteria within the blood and system. Okay, so we gotta find out if your kids have this issue. If they do, we gotta give them the stuff, the remedies to help them get rid of all this bacteria, virus, fungus, and molds and parasites. Once we find out, once they eradicate these issues, the kids, the itchiness improve right away. Within weeks or 2 weeks, you'll be surprised how fast they react. You'll be surprised how fast when all these stuff are gone, how fast they recover. You'll be surprised. Different organs. Now, when kids come into my clinic, I always check their liver, the kidney, the blood, and their lymphatic system. Of course, I check others. I check also the stomach, the small intestine, the large intestine, but primarily liver and kidney. Why? Because these are detox organs. If your kids have so many toxins, which you've been feeding the horrible powder, the hormone-injected milk food, the environment toxicity, they're all inside the kid's body. They cannot handle it. The immune system shut down, and the skin comes out itchy, going crazy. Why? This body is not working. The liver doesn't work. The kidney doesn't work. The lymphatic system is not pumping out the toxin. The blood is not flowing. Of course the body is going to break down, right? So our aim, our goal is to help the body recover, help the organ recover, get the liver start working, get the kidney start working, get the lymphatic and blood system start draining bad stuff out of the body. That's our job. We're helping the body to heal itself. Okay? Emotion stress, the stress of the family, stress of maybe husband and wife constantly fight with each other. Okay, maybe the family issue, maybe the money issue. Kids can pick it up. Okay, kids pick it up. If there's constant stresses in the family, the immune system also shuts down. So we gotta find the emotional cause. We'll find it. There are techniques that we do to help find out the emotional cause, the stress that the baby has. Okay? We talk about circulation and lymphatic system. The lymphatic system, we call lymph node. Lymph nodes are everywhere. Lymph nodes are in our skin, under our skin. It's in the muscles, in the organs, in the brain. It's just all over the place. If the lymph system does not work, the body cannot drain away the toxin, cannot drain away the bad stuff. All right. Now, for example, piping system in the house, right? If you're in the kitchen and you're washing dishes and all that, and the water just comes up and doesn't come down, what happened? The pipe clogged up. Something is happening to the pipe. Okay, so you gotta find somebody, water guy, to clean out the pipe for you, and the water starts draining again. Right? So the lymphatic system is like a piping system in our house. When the lymphatic system is stuck, the stuff in the body, when the lymphatic system, the stuff in the lymphatic system is not draining, then the body cannot clear all this junk issue. So there are ways, there are remedy, there are homeopathic, there are supplement, there are herbs will help you drain the lymphatic system to make sure they open up, they make sure they clean, they drains. Okay. Nutritional deficiency is also another cause of decreasing the immune system. Our body needs nutrient, right? The stuff we feed ourselves to our kids nowadays, it just doesn't have the nutrient that it used to have. Okay, genetically modified food we talk about has no nutrient value because everything is modified. The food that's filled with chemical, toxin, preservatives, the nutrition level is very, very low. Okay, the food's been sprayed with pesticide. The nutritional and the soil, they absorb the pesticide. Right? Think about it. The soil absorbs the pesticide years after years, season after season, day after day. The vegetable, the fruits that it grows out of the soil, what's in it? Pesticide. So soil has no value, have no minerals, because all the pesticide, they destroy all the mineral in the soil. They destroyed it. So the tomato you eat, huge, beautiful, but has 5% of the nutrient compared to 50 years ago, where there's no pesticide, where the soils are rich. Okay, so when you come to the clinic, we will find out exactly what nutrient is missing from your child's body or your body. Is it mineral? Is it amino acid? Vitamin A to Z, essential fatty acid, calcium, magnesium, phosphorus, vitamin D, earth metal, etc., etc. Dirty electricity is all over the place. The cell phone, the iPad, the Wi-Fi field, these electricity affects the function of our cell, the DNA reproduction. So we want to make sure that our body is clear of this bad electricity. So the very first advice that I give to parents is do not have your kids play with iPad too much. Do not have them hold the iPhone. Do not have them sleep with the cell phone on the side. Okay? Even mother. Most importantly, the mother, because mother is breastfeeding. Whatever the mother receives, it comes into the milk. So the milk will carry, if the mother is constantly using the iPad all the time, constantly carrying the phone in the pocket, the negative charge energy is going to stay in the mother's milk. It's going to affect the baby as well too. Okay, that's also a big thing. Okay. So mother's health is extremely important. We just discussed that before. So make sure when mother is breastfeeding, do not take any prescription drugs. Do not take the wrong supplement. If you're taking the supplement that is chemically made, please change to a whole food supplement. Or find out the right supplement for your body type. Okay, that's important. Okay, like I said, also no radiation, no computer. Make sure the mother eat a lot of nutritious food. Okay, make sure the mother is not overly stressed because when the mother is very stressed, the stress changes the milk, changes the taste of the milk, changes the structure of the milk as well too. Okay, and layers and layers and layers of issue. We just talk about all different layers, toxin layer, inflammation layer, sugar layer, food layer, radiation layer, the dirty electricity layer, the nutrition layer. All these layers are like an onion. So when we are looking at the kid's body, looking at the eczema, we're looking at different layers of issue. Also parasite layer, fungus, and immune system, and all that. And each and every one of them, all of the layers, has to be taken away. Has to be taken away in order for the kids to be completely recover from the skin issue, from food allergy, skin allergy, environmental allergy, and all that. Okay. There are several blood tests that we can do for you or your kids. We test for the immune system. Okay, white blood cell, basophil, eosinophil, neutrophil, leukocytes, TB lymphocyte, natural killer cell, cytokinin, T helper cell 1 and 2, interleukin 1, 2, 3, 4, 5, 10, 6, IgG, IgE, IgA, IgD, and all the food sensitivity tests. We call it RAS tests. Okay. This is very important. Most doctors out there, the skin doctor or the medical doctor, they only do the RAS test, or they only do the white blood cell, and that's all. They never ever go into this detail. Okay, this has to be done in order for us to find out what's going on with your immune system. Okay, inflammation panel. Homocysteine, C-reactive protein, RANA, ESR, uric acid, RA factor, fasting glucose, and HbA1c. Now, these two are the sugar. If there's too much sugar in the body increases inflammation. Now, the inflammation, a lot of these are for a patient that has maybe lupus, arthritis rheumatoid, inflammatory disease. But skin in itself is also considered an inflammatory disease. Why? Because it's red, it's itchy, it inflames, it swells up. That's inflammation. Okay, so check these. Okay, we also do Chinese pulsing. So when kids come in, when adults come in, I will check their pulses. I will check the pulse for the heat, for the cold, for the damp, for fluid, for blood, all the organ point, all the organ stresses. And we also check to see if there's any chemical issue that's affecting the body system. Check the brain, neurology, the EMF, everything could be tested by the pulse, everything. Okay, so we use the pulsing system along with the blood test results to determine what's going on with the kids. Okay, there's also another blood test that we do. It's called live blood. So basically, we take 1 drop of blood and we put it under the microscope, and we can see if the blood is healthy. If the blood is nice and round individual, that's a beautiful, healthy blood. If the bloods are clumped up, or if the blood is mutated, then we know there's something wrong with your blood. That's how we find out if there's bacteria, parasite, fungus issue inside of your blood. Sometimes we can even see parasites wiggling around, swimming around in the blood system. We see that. Okay, we have actually recorded video of that in our database. Okay, that's how dirty our blood is compared to some of the kids or some of the adults that come in that has severe skin issue. Allergy issue. We might also do stool tests to see if there's any parasite in the stool or any bacteria, virus, fungus in the stools. Okay, we talked about the food already, and there are extra tests. Okay, if we could not find anything from the standard blood test, there are also another test we call it Cyrex testing, Cyrex 3, Cyrex 4. And these are testing for gluten sensitivity, testing for other foods such as corn, rice, potato, coffee, another grain, dairy, soy, eggs, chicken, etc., etc. Okay. So what makes us different from other medical doctors, from other neurologists? From other dermatologists. Okay. You can see right away, we do multiple testing. We make sure we check into different layers of the issues. We make sure that we address everything that the body needs to be addressed. We make sure the immune system comes up. Okay, we don't just give you skin cream and apply it. We don't just do that. Okay, we actually are treating the whole body. We're treating the whole system. Okay, that is the primary goal of our programs. Okay, so we leave no stone unturned. Every layer we discover, and we take care of every single layer, every single cause. Okay, so what therapy that we use? What kind of treatment we use for kids that has allergies? Okay, we call it metabolic treatment. Why? Because we use whole food supplements, we use herbs, we use homeopathics. Okay, we first of all find out exactly the cause, and we give you the right supplements. So the body immune system that comes up. So the liver, the kidney, the lymphatic system, the blood can be drained. So the parasite, the fungus, the bacteria can be killed with the supplements. Okay. So we also give the body the right nutrient. If you're missing vitamin B, we give you vitamin B. If you're missing vitamin K, we give a K. If you're missing the mineral, we give you the minerals. Okay, we give whatever the body needs. The body's immune system will come up. And most of all, we help you and your kids with your diet issue. We will tell you exactly what you should eat, what you should not eat, what you cannot eat, what food causes problem. Okay, you probably may know this already, but we'll give you much more detailed information in regards to your particular body type, particular blood. Okay, there's another therapy we call it Rife therapy. This Rife therapy is created to kill bacteria, to kill virus, to kill parasite, to kill funguses. Okay, help to drain the blood. Okay, this machine can do all that as well too. Okay, we just have to find the right frequency. This is a frequency-based machine. Okay, we have to find the right frequency, and the antigen will be killed. Okay, detox therapy. We talk about a toxin a lot because we're taking in constantly a lot of toxin, environment, the food. So we have a machine that will clear out the toxicity in your system to make sure all the bad stuff goes out to your lymphatic system and drain out of the system. Okay, electromagnetic, this is called the electromagnetic field therapy. Okay, so remember we talked about the bad electricity, right? The cell phone, iPad, the Wi-Fi, and we're receiving all these bad electricity. The body sometimes cannot handle it. The body has too much bad electricity, and our cell cannot produce. Remember we talked about that? Now, PEMF therapy, what we do is we create, the system generates good electricity. Now, good electricity is like electricity that is created by the earth, right? The good energy. If you go on hiking, the mountains, the trees, the soils, the good energy, right? If you walk on the grass, you absorb the energy of the earth, okay? These are what we call a good electricity. Now, we're created to receive these good electricity, but we're constantly staying in house, we're constantly watching TV, we're constantly surrounded with this bad electricity. That's why our body needs to be cleared. So that's why we have a machine to generate good electricity in your body. So our DNA could be healthy, our chromosome will be healthy, our blood system or white blood cell, our white blood cell will receive good charges. So your body will have good energy. Good energy help you repair the system, increase immune system. Okay, we also do spinal correction, alignment. Why? Because if you know the spine, every organ, let's say the heart receives its nerve innervation from the spine. Stomach receives innervation from the lower spine. Our arms receive innervation from the neck spine. Our liver, our kidney receive nerve innervation or nerve information from the spine. So the spine has to be aligned. Spine has to be in the correct place in order for the nerve impulses to travel to different organs, to different muscles, or also to different parts of the skin. Our skin is also very much attached to the nervous system of our body. Right? If you scratch the skin, you feel it. That's nerve. If you cut it, you have pain. That's nerve sensation. So there are nerve endings under every skin. So a nerve has to be clear. The nerve has to be healthy. Okay, this is one of the techniques that we use to clear the food sensitivity. If you have sensitivity at the food to apples, to grains, to sugars, then we use this technique to clear the body of that particular allergen. Kind of like we let the body open up the system, so we receive the energy of the apples that you're allergic to. Receive the energy of the beef that you're allergic to. Receive the energy of the peanuts you're allergic to. So once the energy of the peanut and your body energy is mixed together, is mingled together, the body no longer rejects it. Right? At the same time, when we do this, immune system comes up. This is very powerful tools that we use. Okay, and also we have a specialized anti-itch spray. Now this spray is really amazing. It's a special formulated brand that we created, put on the skin, and the skin allergy, the eczema goes away really, really quickly. But in order for us to use this particular spray, we gotta make sure we fix every single causes. We fix the body first. Fix the body. Fix the organ, fix the blood, fix the lymphatic system, fix the nutrition need deficiency issue. Okay, fix nerve issue. Okay. Then at the very end, we use this one. And everybody, I mean every single person that comes in with allergy, they all clear. Not one single that does not clear. Not one single one. Okay. We use also other energy therapy. We do field control therapy. We use chi therapy, emotional therapy, acupuncture point therapy, nutrition response therapy. A lot of stuff that we do, that we learn to help with the skin issue. And I combine all that together to help the kids and people that comes in with skin and allergy issue. Okay, the program we offer, it's very, very unique. Okay, you come in, not only does your skin gets better, allergy is gone, but your entire body gets better. Okay, you might you sleep better, circulation is better, no more constipation, no more aches and pains. Your whole body gets better. Okay, that's a huge difference from us compared to the medical standard routes. Okay, so imagine this. Imagine your baby sleeping soundly every night. That is how I feel now. My boy, my girl, they sleep every night, all through the night. No more itches, no more sicknesses. They're healthy. And that's what it makes me happy. As a father, it makes me feel good and happy and satisfied that my kids are healthy. When they're healthy, I can continue do my own thing. I can continue help other patients. I don't have to be distracted. Okay, that's very, very, very important. Okay, also imagine your kids be able to eat anything they want. They go out, travel on a cruises, on a vacation, in a restaurant, they can eat anything they want. Imagine that. Happy, that's the feeling of happiness. Okay, you'll see when your kids are completely covered, completely gone of allergy, you'll see. Okay, like we said, we offer a consultation. Okay, a free consultation. So you gotta watch it twice, or else the consultation would be charged $120. If you watch it twice, it'll be free for you. Okay, so what you do is, first of all, you come in, we take the full history, then we do testing, we do the pulse testing, we give you the blood test, we give you other tests, whatever test you need. You do that, and you go home. Okay? And the second time you come in, we give you report of finding. We tell you what's going on with your skin allergy, with your kid's skin allergy. We tell you how we go about treating it. We discuss the full panel of the blood results. Okay? And we also discuss with you the option for care and how much it's going to cost, and how much treatment that you need to get better. Okay. Now we don't take every single patient. If the mother and the father, they smoke or they drink alcohol, or if they're taking a lot of medication, or the kids are taking a lot of medication, it's going to be very, very difficult. Okay? I usually do not want to take those kind of cases. Okay, usually don't. And we select our patient. So you got to be qualified in order to become our patient base. Okay. All right, so we usually require patients or the parents that they have to be committed. Some parents, when they come in, they're like, oh, my kid's okay. Sometimes they itch, sometimes they don't. They don't really care about their health. I push it away. I do not take those kind of patients. I do not take the parents that are not serious about their kids' health. I do not take them. I push it away. Okay, the parents have to have a mental set that they are going to do anything, whatever they can do to make them or their kids better. It means changing a lifestyle. It means changing the food. It means changing the diet. It means feeding them the supplements. It means the mother herself has to control the diet, has to change the diet, has to change the lifestyle. Okay, you are responsible for your health. You are responsible for your kids' health. If you leave everything to me, it will not work. I had to do it, and you had to do it with me. You had to do it with me in order for your kids or you to get a complete recovery. Okay, if you don't have that responsibility, if you're not willing to do anything, if you're not willing to take supplement, if you're not willing to change diet, if you're not willing to control your food intake, do not come. I will not take you. Okay? A lot of patients, when they come in, they ask me, does my insurance cover? You must understand that this care is not covered by the insurance. It's not. Okay? At very best, the insurance will cover a small portion of it. Okay? Maybe the correction of the alignment part. maybe the part with the infrared laser. But most of the time, they will not cover the whole treatment. Okay, so be prepared to spend some money to get your kids better. Okay, but of course, when you come in, give us the information, just the insurance information. That we'll call the insurance company and we'll tell you the coverage that it needs to, the coverage that your insurance covers. Okay, if you have Medicare, Medi-Cal, Obamacare, Cover California, HMO, they just don't pay. I'm sorry, they do not pay. Okay, when you come with you, please bring your significant other with you, or your partner, or whoever is living with you, taking care of the baby. Please bring them together with you because they need to understand what's going on with the baby. They need to understand what's going on with you. They need to understand what's causing all this allergic reaction, this itchiness, this red skin. They need to understand. They need to give you support, support of the love support, family support, diet change support, financial support. Okay, both sides have to be completely in order for the kids, for you to get a complete recovery. Okay, please don't just come by yourself. Okay, if you are by yourself, then I'm okay with that. Okay, people always ask me, are they going to get better within one session? There is no miracle. I'm sorry, there is no miracle. The symptom does not completely go away within a few sessions. Especially when your kids have severe eczema. We have severe allergy, skin allergy reaction. For years, 2 years, 3 years, for 6, 7 months. Okay, it will take sometime a good month or two, sometime 3 months, sometime 4 months to see a complete recovery. But never just few visits, never just few weeks, never. Okay, so be patient. Be patient. Body needs to change. Body needs time to change. Okay? All right, so if you have any question, give us a call. Phone number, area code 626-281-0510. Or you can email us in regards to a consultation that you're going to come in. Any question in regards to food, the diet, any question at all, please contact us. This is Dr. Lin. Thank you for watching.